assist the physician in determining the origin of tissue damage and organ disease. Certain metabolites can be made to decompose to desired end products in a test tube. However, extremes in temperature and pH, incompatible with life, are needed. The same metabolic processes occur in the body under physiologic conditions, a pH near neutrality and a temperature near 37 degrees Celsius. This occurs through the action of enzymes, catalysts of biologic origin. A chemical catalyst is a substance which increases the rate of a particular reaction without itself being consumed or permanently changed. A catalyst affects only the rate at which a reaction proceeds, that is, the rate at which a reaction reaches equilibrium. It does not enable a reaction to proceed past its normal equilibrium point. Because catalysts are not altered during the reaction, they are capable of carrying on their catalytic effects repeatedly. Consequently, very small quantities of catalyst are capable of affecting relatively large quantities of the reactants. Enzymes are proteins which catalyze specific metabolic reactions. They are synthesized in the cell and are important in its functions. It has access to the plasma from intact cells through their permeability, or from injured cells through the ruptured cell walls. Under normal conditions, the activities of many enzymes in the blood are held at relatively constant levels by the balance between enzyme synthesis and breakdown. The serum levels of a particular enzyme may be increased or decreased by diseases that lead to increased rates of enzyme release, to increased amounts available for release, or to decreased rate of enzyme breakdown. Changes in serum enzyme activity can thus be indicative of bodily disorders as well as in diagnosis, prognosis, and in assessing therapy effectiveness. Enzyme determinations in tissue are generally still relegated to the research laboratory. However, enzyme determinations in serum and less often in other body fluids are now routine in many clinical laboratories. As biologic catalysts, enzymes retain the characteristics of chemical catalysts. They increase the reaction rate, they remain unchanged after the reaction, and they are highly efficient. Because they are unaltered, a single enzyme molecule may interact with an astronomical number of reactant molecules. For example, 1 mole of enzyme may interact with 10,000 to 1,000,000 moles of reactant molecules per minute. Some enzymes are so specific that they catalyze a single type of reactant, for example urease, which acts only on urea. Others may act on many substrates, for example alkaline phosphatase, which may act on phenol phosphate, glycine phosphate, etc. As proteins, enzymes possess all the properties common with other proteins, having molecular weight on the order of 10,000 to well over 1,000,000. The ribonuclease A molecule shown at the beginning of this presentation is relatively small, having a molecular weight of only 12,700. Enzymes are labile. Subtle changes in their structure, called denaturization, can cause them to lose their activity. Consequently, they must be handled quite carefully. Adverse conditions of temperature, pH, and salt concentration are only a few factors known to cause denaturization. As proteins, enzymes are multi-valent electrolytes containing ionizable groups. The ionization state, which affects enzyme activity, depends on the hydrogen ion concentration, that is, pH. As electrolytes, enzymes migrate in an electrical field, positive molecules migrating towards the cathode, negative molecules migrating towards the anode. The greater the net charge, the faster the migration. This property is used in diagnostic enzymology to separate isoenzymes and will be discussed later in this presentation. Enzymes are named according to the starting material or chemical group they act upon by adding the suffix ase. Consequently, the enzyme hydrolyzing urea is called urease. That acts on phosphate esters is called phosphatase, and so on. Enzymes of diagnostic value may be classified as transferases, oxidoreductases, hydrolases, and lyases. Transferases catalyze the transfer of chemical groups, such as an amino or phosphate group, from one compound to another. Oxidoreductases, so referred to as dehydrogenases, catalyze electron transfer. Hydrolases catalyze substrate breakdown with water fixation. And lyases are enzymes that split carbon-to-carbon bonds without the transfer of chemical groups. Described simply, enzymatic reaction involves two steps. The first step is a combination of the enzyme E with the substrate S to form an enzyme substrate complex, ES. The second step is the decomposition of the enzyme substrate complex to yield the reaction product P and the unchanged enzyme. The velocity of an enzyme reaction will depend on the time required for the enzyme substrate combination and the time required for the enzyme to form the product. Obviously, the time required for the formation of the enzyme substrate complex will depend on the enzyme concentration and the substrate concentration. The ability of an enzyme to catalyze a specific reaction is called its activity. Activity is a measure of the rate at which the reaction proceeds. Enzymes are measured in terms of activity rather than concentration because of their chemical similarities and their extremely low concentrations in biological fluids. The international unit of enzyme activity is defined as the amount of enzyme which will catalyze the transformation of 1 micromole of substrate per minute under certain specified conditions such as pH and temperature. A milliunit is 1,000th of international unit. Enzyme activity is normally expressed in international units per milliliter of enzyme-containing solution, or where this value is inconveniently small, as milliunits per milliliter. Enzyme activity depends on a number of factors such as temperature, pH, substrate, coenzyme, and inhibitors. Increasing the temperature increases the rate of enzyme activity as shown here. At the same time, denaturization of the protein can result in the loss of enzyme activity. This thermal deactivation depends on the length of time an enzyme is exposed to the particular temperature. As shown by the linear 20 and 30 degree centigrade curves in this figure, thermal denaturization is negligible for most enzymes below about 30 degrees centigrade. However, between 30 degrees and 40 degrees, some denaturization occurs as illustrated by the bending of the 40 degree curve. At 60 degrees centigrade, most enzymes are denatured after only a few minutes, as shown here. In 1961, the Commission on Enzymes of the International Union of Biochemistry recommended that all enzyme measurements be made at 30 degrees centigrade. However, for historical reasons, convenience, where low enzyme activity and small samples are involved, other temperatures such as ambient, 25, 32, and 37 degrees continue to be used. Generally speaking, for each 10-degree rise in temperature, many enzymes will exhibit a twofold increase in activity. A temperature difference of only 1 degree changes the activity of some enzymes by as much as 4 to 10%. Therefore, it is essential to carefully control the temperature of specimens, solutions, and spectrophotometer cells during enzyme assays. A characteristic bell-shaped curve is obtained when enzyme activity is plotted against pH. The pH optimum, the pH at which greatest activity occurs, corresponds to the vertex of the curve. This pH optimum depends on the environment in which the reaction takes place. For example, the nature of the buffer, the nature and concentration of the substrate, and the presence of activators or inhibitors can all affect the optimum pH. If all other variables in an enzyme reaction remain constant, the reaction velocity depends on the substrate concentration S, as shown here. At relatively large substrate concentrations, the enzyme becomes saturated with substrate and the reaction velocity reaches a maximum, Vmax. Any further addition of substrate will not significantly increase the reaction velocity. During the period where the substrate concentration is low with respect to the enzyme concentration, the reaction is termed first order. Under these conditions, the reaction rate is greatly influenced by the substrate concentration. At high substrate concentrations, the reaction rate reaches a maximum and the reaction is termed zero order. Under these conditions, the reaction rate becomes independent of the substrate concentration. When measuring enzyme activity, only the zero order curve should be used, so that the assay is a reflection of enzyme activity only. The Michaelis-Menten constant, Km, can be determined from the substrate constant examined earlier. Km is numerically equal to the concentration of the substrate in moles per liter when the velocity of the enzyme reaction reaches 1/2 its maximum velocity, Vmax. It is a number characteristic of each enzyme pair. In addition to having practical applications in the clinical laboratory, this constant can be used in the development of new methods for measuring enzyme activity. For example, the affinity of a non-specific enzyme for different substrates, as defined by their Kms, can help in selecting the appropriate substrate. Enzymes often require the presence of certain organic but non-protein factors called coenzymes. They are relatively low molecular weight with respect to enzyme proteins and are often required for the correct positioning of the enzyme and substrate so that a reaction can proceed. Many coenzymes are derived from dietary vitamins, especially the B-complex vitamins. For example, niacin is the precursor of two coenzymes, nicotinamide adenine dinucleotide, or NAD, and nicotinamide adenine dinucleotide phosphate, or NAD. NAD and NADP are essential for the activity of a group of dehydrogenases. Inorganic ions such as magnesium, manganese, zinc, and iron are also sometimes regarded as coenzymes since these metal ions have been found necessary to activate certain enzymes. In either case, coenzymes must be to many enzyme assay systems in sufficient amounts so as not to be limiting factors in the reaction. Inhibitors can cause enzyme reactions to proceed more slowly than expected for given conditions of pH and substrate coenzyme concentrations. Inhibitors may be substances which compete for the active sites on enzymes and generally have chemical structures very similar to those of the substrates. That is, the inhibitors compete with the substrates for the enzymes. For example, hexakinase, which acts upon D-glucose, is inhibited by D-xylase, or 6-deoxy-D-glucose. An inhibitor may also slow a reaction by binding to the enzyme at a point other than that at which the substrate is bound. In this case, the inhibitor alters the enzyme structure so it decrease or even stop the enzyme activity. An important example of this is the fluoride ion, which inactivates enolase. Enolase is involved in the metabolism of glucose. Consequently, fluoride ion is often used as a preservative in glucose determinations. Inhibitors have been used to gain information on complex enzyme systems and to better understand the single reaction mechanisms. Naturally occurring inhibitors in serum do not have a significant influence on in vitro assays of enzymes. However, urine frequently contains inhibitors which hamper certain enzyme assays, and the urine must be dialyzed prior to enzymatic analysis. Enzymes which catalyze the same chemical reaction but exhibit differences in their biochemical, physical, and immunological properties are termed isoenzymes. Chief among these differences are differences in their rates of electrophoretic migration. For example, under electrophoresis, LDH can be separated into 5 distinct fractions. The various bodily organ tissues contain characteristic proportions of the different isoenzymes. When a specific organ or tissue is damaged, the cellular enzymes are released into the plasma where they superimpose their isoenzyme patterns on those normally present. Consequently, a measure of the serum isoenzyme patterns obtained by electrophoresis can often reveal the damaged tissue. Modern ultraviolet visible spectrophotometers now permit enzyme activities to be measured conveniently, quickly, and accurately. If the substrate acted upon or the product formed are colored or can be coupled to secondary reactions which produce colored products, then the reaction can be monitored with a colorimeter, that is, a spectrometer measuring changes in visible light intensity. Quantitative ultraviolet measurements of enzyme activity are becoming the more accepted approach, however. Preference arises for a number of reasons, but mainly because ultraviolet methods avoid the additional steps, reagents, and undesirable side reactions usually required to produce colored reactants and products. For example, a common ultraviolet approach involves NAD and NADH. As shown in this ultraviolet spectrum, NAD is a characteristic and relatively high absorption at 340 nanometers. NAD has virtually no absorption at this wavelength. Consequently, any changes in the NADH concentration, either increasing or decreasing, can easily be monitored with little or no interference due to corresponding changes in NAD concentrations. A specific example of the usefulness of these ultraviolet absorption characteristics in the assay of LDH using the analytical schemes shown here. In one case, pyruvate and NADH are catalyzed by LDH-P to produce lactate and NAD. In this case, the NADH concentration would decrease and produce decreasing ultraviolet absorption. In the other case, the opposite reaction is catalyzed by LDH-L to produce increasing concentrations of NADH. Enzyme reactions which do not involve NADH or NAD may often be coupled with other reactions which do involve these compounds, for example in GO assays. In the upper reaction, aspartate and alpha-ketoglutarate are catalyzed by GOT, glutamate, and oxalacetate. The lower reaction, coupled to the first reaction, involves generated alacetate, NADH, and a second enzyme, malic dehydrogenase, to produce malate. Consequently, for every mole of octylacetate produced by GOT, a mole of NADH is consumed and the absorbance change directly proportional to GOT activity. There are several ultraviolet visible spectrophotometric methods which are commonly used to determine enzyme activity levels. The two-point procedure involves measuring the amount of product formed, or the decrease in substrate, over a given interval of time. For example, serum samples are added to substrate solutions of known concentration, and after a period of incubation, the substrate or product is again measured. The difference then represents the amount of substrate transformed during the incubation period and provides an indirect measure of enzyme activity. The two-point procedure assumes the reaction to be linear over the time interval chosen and does not allow visual inspection of the parameters which might alter the expected linear or zero-order kinetics. One example of possible interpretation can be seen in this figure. However, by carefully controlling the time sequence involved, samples requiring the same assay can be batched and large numbers of samples can be processed rapidly. The kinetic approach, where the reaction kinetics are monitored continuously, is generally regarded as a more sound analytical method. If, for example, the product is colored or exhibits ultraviolet absorption, as in the case of NAD/NADH, its formation or depletion can be continuously monitored and recorded as the reaction proceeds. Enzyme activity can then be determined by measuring the slope of the linear portion of the reaction curve. The kinetic approach offers a number of advantages over the two-point procedure. There is visual proof of linear kinetics, obviating substrate depletion and lag phase nonlinearities. There is visual indication of falsely negative values due to product inhibition or the reverse reaction. Maximum accuracy can be obtained since the slope or activity measurement can be made in the region of maximum reaction velocity. The kinetics approach has the disadvantage of requiring samples to be run individually, increasing the analytical time involved. In addition, the spectrophotometer must have recording capabilities, either as an integral part of the system or through some external arrangement. A popular adaptation of the kinetics approach is to time-share multiple samples within the same recording spectrophotometer. In this case, provision is made to place multiple samples in a sample changer, which repeatedly positions a number of samples in the spectrophotometer beam at predetermined time intervals. For example, sample changers are available which will accommodate 4, 6, or 7 samples. These accessories are typically designed with all necessary timing clocks, temperature control, and stirring mechanisms. An example of the recorded data from one such changer with 4 samples is shown here. In this case, a field temperature data has also been recorded and can be seen as the horizontal data points. This kinetic time-sharing approach minimizes major disadvantages of the normal kinetics method, since more than one sample can be processed at the same time. However, it retains all the advantages associated with the kinetics method. Several quite sophisticated approaches have been developed more recently, which now allow enzyme assays to be performed routinely on as many as 80 samples. These systems will be the subject of future programs. Other future programs in this series will include instrumental methods for determining enzyme structure, instrumental requirements for enzyme assays, Enzymes in Medicine, and Basic Ultraviolet Visible Spectroscopy. This program has explored only a few of the basic considerations of enzyme chemistry and has briefly described several spectrophotometric methods for determining enzyme activity. A full treatment of basic enzymology with emphasis on specific clinical determinations can be found in a Beckman Instruments publication, Basic Clinical Enzymology by George Sims. The fundamentals of ultraviolet visible spectroscopy can be found in another Beckman publication, An Introduction to Ultraviolet Visible Spectrophotometry by Robert Manning. Information concerning current or future programs or any of the mentioned printed materials can be obtained by contacting your nearest Beckman sales representative or application support center.
And here we have placed a dical liner on the axial wall in the area that would most closely approximate the pulp. In placing this calcium hydroxide liner, or the dical, you must remember that you do not block out your undercuts. If you block out your undercuts, you will lose the retention in your cavity preparation. The next thing we are going to place is a cavity varnish over this material. We still have dentin exposed, we have dental tubules exposed that are not covered by the calcium hydroxide. Therefore, we have to cover them up and seal them off. The materials that we have available, as I've told you in the past, are copalite varnish and Varnal. Varnal is used by a great number of men. Here at the school, we use almost exclusively copalite. In this, we are now taking a wisp of cotton and we are applying the copalite varnish over the calcium hydroxide base. One factor that we differentiate here on the silicate preparation is that we do not remove the copalite varnish from the cavity margins. This is a point of discussion. However, at the present time, we have not had enough research, or we do not have published research which shows any advantage to removing the copalite from the enamel margins as we do in a silicate restoration. There is no anti-karyogenic factor present in the composite resin restoration. Therefore, it would have no benefit to the enamel. This is a class 5 restoration, so we are going to use one of those caulk cervical matrices that we've shown you on previous lectures. We have to trim them and fit them according to the tooth. This is how the matrix is supplied by the manufacturer. It's a clear plastic tube of different sizes. And we select a tube, a little plastic tube, that closest approximates the size of that tooth. You'll never find them usually quite exact. You have to make the variations to conform yourself. You have to trim that edge. And this is what we're going to do now. We're going to take a pair of scissors and we're going to trim the shape of that plastic tube to follow the shape of the gingival outline there, or the cervical outline, so that we cover all parts of the cavity preparation. The material we are going to use for this cavity is adaptic. We are using adaptic and concise in the cavity in the clinic. The majority of the time we use adaptic. And in this cavity, this is a very white tooth once again, so we are going to use some opaquer so that the tooth color will be matched by the restorative material. Here's the bottle of opaquer that we showed you just a few minutes ago. We have our material out on this mixed pad. You notice we have approximately equal parts of the catalyst paste and the universal paste. You will note that the opaquer over on the right-hand side is a very small amount. The amount that you wish to use of this material is usually 10% or less of the total volume of the mix that you're making. It takes a very small amount of this material. We insert these materials with the plastic instrument. You remember that I told you that the composite resins are a filled material with inert ingredients, the quartz crystals, the glass beads, the glass rods, so forth. These materials abrade metal instruments. However, on your equipment list, you do not have a special instrument for composite resins, so we must use a plastic instrument. Let me caution you, do not rub these materials with your metal instruments excessively. Just add the material to the cavity pin, and that's all. If you do, the material will abrade the instrument, and you will get particles from your metal instrument into your restoration, which will later discolor your restoration. There are now on the market a great number of different types of Teflon and nylon instruments for handling these, which should be used. However, you do not use it, so we are using the plastic instrument. Caution with them. We have the cervical matrix trimmed and fitted, the material in the cavity, and treating it. And you can see this extruding, especially toward the excisal of the restoration. We remove the matrix, and now you can see it's medial distal, very gentle, and incisal. It's in to keep your gingival excess minimum. This is the hardest place to trim. Is finish this restoration. Remember you about the garnet cuttle disc, and I've told you the difference on them. Once again, the red face disc are the garnet disc and the white face cuttle. And remember, they're according to abrasiveness by the color on the back of the disc. The green being the fine, rough, medium, red, coarse. Here we're going to use a garnet disc off gross excess. There's a little bit of Vaseline on this lubricated. This has a old value. One being that it keeps you from and winding up the rubber in your disc, and also reduces frictional heat in your procedure. Be careful with this disc, especially on cervical, so that you do not hit the tooth. Here we have removed all the excess. We have it fairly trimmed down to the margins. But notice there are black marks all over the surface of this restoration. I've done this on purpose. You might see the instrument. I have chipped margins and rubbed on the material, and you can see where it's picked up pieces of the material instrument in the black marks. However, since this set material and on the surface will polish away, very alarmed, on your restoration. Just take a rubber cup of wet flour of pumice and gently polish the surface lengthily. If you stay on for a long time, the pumice will fade away the resin, and the restoration surface will become very due to the fact that the filling agents do not braid away as it does. And here we have and we have a fairly satisfactory aesthetic result. It will give the patient quite a number of years of service, as well be aesthetically pleasing to the patient. That will conclude our discussion of the eye of restoration. We now like laboratory and carry out this procedure on the prepared. Thank you.